Okay, I think we can get started now. Good morning and welcome to this week's SonoSim Ultrasound webinar. I am your moderator, Heidi Winkowski, and today we'll be focusing on how to remotely integrate physiologic variation and control into ultrasound training scenarios. All attendees will be in listen-only mode and may ask our panelists questions during and after the session in real time through the chat. A recorded version of this webinar will be available after our session. If you're just joining us, welcome. Now it's my pleasure to introduce Product Manager Eric Siri to discuss how to initiate physiologic changes in real time and create dynamic ultrasound training scenarios using SonoSim LiveScan with CaseController. Let's begin.
Hello everyone, my name is Eric Siri and I'm a product manager here at SonoSim. Today I'm going to be walking you through how you can use SonoSim LiveScan to integrate physiological variation and control into your ultrasound training scenarios. Integrating ultrasound into all kinds of medical decision making can improve quality of care and patient safety. However, acquiring the knowledge and skills to perform ultrasound remains challenging for many practitioners due to a lack of training availability. SonoSim LiveScan helps to overcome those barriers by giving your learners the ability to practice realistic scenarios and make real-time decisions using high-quality, real ultrasound imagery of pathological cases. As the use of ultrasound continues to expand, being able to provide this type of simulation experience is very important. Here is how LiveScan works. Today, I'm going to be our ultrasound patient. So I've gone ahead and placed the LiveScan tags onto my body. Each tag corresponds to an ultrasound window. Here's the right chest, left chest, peristernal, and so on. When I place the SonoSim probe onto the tags, the image will appear in the simulator. I can fan, rock, and rotate to survey the anatomy. I can also access various imaging modalities, such as Doppler and M mode as necessary. Here is M mode to assess for pneumothorax. Every single image you see here in the Sono simulator is a real image obtained at the bedside, and each case comes with a case history detailing the patient that we are simulating. By using the case history and findings from the ultrasound exam, your learners can make real-time medical decisions. With SonoSim LiveScan, there are 9 different packages to choose from: trauma care, critical care, cardiac resuscitation, early stage pregnancy, late stage pregnancy, hepatobiliary, genitourinary, ocular, and neonatal infant neurosonography. Each of these packages come with 10 unique cases. If you want to create your own scenarios for your learners, you can use SonoSim Case Builder. Simply choose an ultrasound window and select an ultrasound image. For example, here we are adding a peristernal window dataset that features a patient with a proximal aortic dissection. With SonoSim Case Builder, you will have access to any of the images in your SonoSim LiveScan packages, as well as the extensive SonoSim Case Builder library, which contains hundreds of additional pathologies to choose from. These cases will be available in your Sono simulator to integrate into your simulations. You can also integrate physiological variation into each case using the CaseController feature. With the CaseController, you will be able to access the Sono simulator remotely using any connected device, be it phone, tablet, or another laptop. Here is how it works. In the Sono simulator, we go to Connect, and we'll see a code with a URL. On the second device, again, whether that be your phone, laptop, or tablet, we go to the URL and enter the code. This will open up the CaseController. Now that we are connected, we can remotely manage the training scenario. If we need to pull up the case history, we can just press a button, and the learner will be able to see it on the Sono simulator screen. Does your learner need some expert instructor tips? You can pull up the findings video to help them identify the proper structures. Want to navigate to a different case or recalibrate the SonoSim probe? You can do that here as well. In addition to these controls, you can change the patient's heart rate and respiratory rate on the fly as the scenario dictates. Now, let's put all these pieces together to create a scenario. In SonoSim Case Builder, I have built a case of a 65-year-old male with substernal sharp stabbing chest pain for 2 hours, brought in by paramedics with a BP of 70 over palp and heart rate of 70 BPM. I am using the dataset from earlier, the parasternal window that features elements of a proximal aortic dissection. I have also created a subsequent physiological state, which I may choose to activate as an added learning stimulus, and have labeled it Case 2. In this case, I have chosen to integrate a dataset that features a large pericardial effusion with echocardiographic evidence of tamponade physiology. In the scenario, the learner starts by performing a rush examination on this patient with chest pain. If they correctly identify the pathology, they will note a widened aortic root and aortic dissection flap in the descending aorta. After the learner completes their exam, approximately 1 minute, the patient loses consciousness. The vital signs now reveal no palpable blood pressure. The learner should request that airway and breathing support are provided and chest compressions should be initiated. At this point, I will use the case controller to integrate the next physiological state, which was labeled as Case 2. I will set the heart rate of the patient to 10 BPM and now integrate the data set that featured the evidence of tamponade physiology. If the learner performs a repeat cardiac ultrasound exam during CPR pulse checks, they may be able to arrive at the correct diagnosis and etiology of the patient's circulatory arrest. The learner may attempt to perform a pericardiocentesis, in which case I can use CaseController to bring the heart rate back up to 60 beats per minute. However, if they do not identify the pericardial effusion or attempt pericardiocentesis, I can use the case controller to put the heart rate down to 0, and the patient will die within minutes in this scenario. Let's see how this looks in practice. I'll be connecting with a learner over Zoom. She will be scanning the mannequin at her location, and where I am, I'll be able to interact with the simulation using case controller on my phone. Hello, Jessica. How are you doing today?
I'm good. How are you?
Doing well, thanks. Hopefully you will enjoy the scenario. Hopefully it'll be helpful for you. Let me go ahead and pull up the case history for you so you could take a look. So as you can see, this is a 65-year-old male with substernal sharp stabbing pain for the last 2 hours. His heart rate is 70, and he has a blood pressure of 70 over palp. So we want you to go ahead and do a rush exam.
Okay. First thing I'm going to do is I'm going to start scanning the right chest. Okay, so it looks like I see lung setting here, but I'm going to turn on M mode just to make sure. All right, yeah, I see that looks about normal. Okay, turn that off. So the right chest looks good, no fluid. I'm going to switch over to the left chest. Again, looks like lung setting, but let me turn on Doppler, or excuse me, M mode to make sure. All right, that is also looking good. Next, I'm going to move on to the RUQ. Okay, there we go, clear up. Let me scan through a little bit. Okay, there's the kidney. I don't see any free fluid. Scan through in short really quick. Okay, looking like a normal RUQ. Now let me go to the LUQ. Okay, here is the left kidney. Again, no fluid. Scanning through in long. Now let me switch over to short. Scan through again. All right, that's looking like a normal LUQ. Okay, now I'm going to move on to the heart. Let's start with the parasternal window. So I'm scanning through, and it's looking like there might be an abnormality at the bottom of the screen. It's looking like that might be an aortic dissection flap.
Okay, so we finished the rush scan and we noticed that there's a dissection flap. Now let's say we finished the scan and the patient loses consciousness and we notice that the vitals, there's no palpable blood pressure anymore. What would we do next?
Okay, well, the first thing I would do is get airway and breathing support, and then I would have them start CPR. And then during CPR, during the pulse checks, I would do another cardiac exam to examine their heart.
Okay.
So let's say that it's during the pulse check. I'm going to start looking at the apical window. Ooh, okay, so the heart isn't beating very much at all, and it looks like there is fluid surrounding the heart. So at this point, with the heart not beating and fluid surrounding the heart, I would do an emergency pericardiocentesis to drain that fluid.
Okay, great. So we did the pericardiocentesis. The patient's heart rate went back up to 60, and that's going to end our scenario. Good job. The combination of SonoSim LiveScan with CaseBuilder and CaseController gives you the ability to remotely control your training scenarios and implement physiologic variations on the fly, which result in more realistic, dynamic, and engaging training cases. I hope that was helpful, and I will pass it back to Heidi to facilitate our Q&A time.